kid where you're always afraid to go to the dentist? We've got actually some exciting news that will have your kids grinning from ear to ear. A trip to the dentist's office is no longer something a child has to dread. Joining us with the latest on children's dentistry is Dr. Marilyn Miller, co-director of the Princeton Dental Resource Center. Let's go on over and talk to her. All right. Hi, doctor. How you doing?
And what's really exciting is that research is telling us today that certain foods actually can help prevent getting a cavity.
Cliff is at the dentist that you have never in your life seen, and after you see what you're going to see, you're going to want to go to the dentist.
Exactly. This camera, as you can see, is very small. It's the size of a normal dental mirror.
It's got a little light on it. We can see that light.
That's right. Look at that. It's similar, but not exactly the same. It also raises what we call serotonin in the brain. It's a chemical in the brain, and it raises the pain threshold so that what once was a painful experience no longer is.
I knew a dental hygienist whose name was Serotonin. Isn't that incredible? Now, are you telling me this is the #1 freak-out thing, isn't it, for people?
It is. It's the #1 reason why people do not go to the dentist.
This is the Morning Exchange with Greg Griffith and Lee Jordan.
This is Marilyn Miller. She is a pediatric dentist.
Dr. Marilyn Miller is the co-director. Dr. Marilyn Miller joins us now. Joining us today with more on how to get your kids on the right track, Dr. Marilyn Miller.
Because as we were discussing, things in dentistry change very rapidly, and so we want to have everyone to have access to all the new information.
Not much what you eat, but how often you eat. That's really the key, because a lot of the foods we eat can enter into the cavity process.
So probably the best advice for parents is just to make sure your child is practicing good oral hygiene, and also kind of help them choose snacks, a variety of snacks that they can enjoy in moderation.
Explains to the dentists in the nation, I guess, what's going on at the research level. And I was surprised that in some of the material here, sometimes there's a gap of as many as 10 years getting from the laboratory into the practicing dentist's office.
That's true. You know, that's true in medicine as well. We're finding that it's just an onslaught of new information, and it's hard to keep up.
And here with an explanation of that is Dr. Marilyn Miller, and she is co-director of the Princeton Dental Resource Center.
That's right. Well, what's new and different is that today people can feel comfortable snacking 2 or 3 times a day as long as they're getting proper amounts of fluoride. The licorice has a special property. It's called glycyrrhizine. The cheese prevents acid production in the mouth. And the peanuts actually help food to clear faster.
In addition to monitoring the work of researchers, the directors of the Princeton Dental Resource Center travel around the country, lecturing at state and regional dental meetings and learning about the concerns and interests of the dental community. They also accept invitations to speak at dental schools.
Through interviews and specially prepared articles, we furnish information to professional publications. We cover everything from insights into fluoride action to laser technology. We give interviews to the magazines and newspapers we know consumers read. We also are interviewed by reporters at radio and television stations across the country, reaching millions of potential patients.